Welcome back to EyeWonder. Today I wonder what are cranial nerves and what do they do. Now there are 12 cranial nerves inside the whole brain, but today we'll only be talking about the first 7, which have a little more relevance to neuro-ophthalmology. Now the first is called the olfactory nerve. Obviously it has to do with smell. The second is the optic nerve. There are 2 optic nerves, one connects to each eye. They go back into the brain, they cross up the optic chiasm, the image is flipped a little further, and then they meet again at the occipital lobe. The third is the ocular motor nerve, which controls most of the motor functions of the eye and the eyelid, except a few more specific ones, which we'll get to later on. The fourth is the trochlear nerve, which controls the superior obliques and what we call incyclotorsion, which is turning of the eyes. The fifth is the trigeminal nerve, and among chewing or mastication, it also allows sensation of the face. The sixth is the Abducens nerve. And if you remember to an earlier video where we talked about the musculature of the eye, there's a lateral rectus, medial rectus, superior rectus, and inferior rectus. The abducens controls the lateral rectus, as the etymology suggests. Ab in Latin means away, so it helps the lateral rectus look away from the center of the face. The seventh is the facial nerve, and this controls facial expression. Now, Dr. Lee, as a neuro-ophthalmologist, you still have to know the other 5 cranial nerves. Why is this?
Yeah, so that's correct. So you gave a very good demonstration of the importance of knowing these cranial nerves. The second for seeing, 3, 4, and 6 for moving the eyes. However, these other cranial nerves are also important to us because they live next to the other nerves. So they're numbered for a reason, and that reason is you need to know the numbers in order because they live right next to each other. So the 8th nerve is for hearing. Lend me this for a second, Christopher. And that is for the hearing and the balance, and that's why it's the 8th nerve is called the vestibular cochlear nerve. The cochlear part is for the hearing, the vestibular part is for the balance part. The 9 and 10 are lower cranial nerves that are involved in controlling your swallowing, and the 11th has a number of functions like raising some of your accessory muscles in your neck that might help for breathing, and the 12th is your tongue nerve. So these nerves 8 through 12 are not as important to neuro-ophthalmologists because they are in the medulla and the lower cerebellopontine angle, so they really don't come to us very often. So the ones that Christopher has talked about are way more important to us because it does the seeing and the moving of the eye and the moving of the face. So you really need to concentrate on 1 through 7. And I always say an ophthalmologist has to be able to count to 7. 7 cranial nerves are necessary for everyday ophthalmology, and then rarely we have to go down to the medulla and know the other numbers.
Thank you.